I'll show you certain examples of isotonic solution which we commonly used for different types of therapy. Some isotonic solution. Okay, so what are those isotonic solution? Isotonic solution means the tonicity of all of this solution is almost equal to plasma osmolality. Plasma osmolality, that is approximately 300 milliosmol per liter. We take approximately 300, but it is exactly 280 to 290 milliosmol per liter. So 5% mannitol is an isotonic solution. 5% dextrose is also an isotonic solution, but here you have to be cautious. 5% dextrose solution, it is isotonic in vitro, means if you make a solution of 5% dextrose, okay, in a bottle, that is isotonic, means tonicity or osmolality is 290 to 300 milliosmol per liter, right? But whenever this solution enter in your plasma, okay, what will happen? This glucose will be taken out by the cells, okay, and only water will remain in the plasma. Getting my point? So whenever you are drinking dextrose solution, the glucose will be taken out by the cell and only free water will remain in the plasma. That means now this 5% dextrose solution is converted into only water, that is nothing but hypotonic. That's why we say that 5% dextrose solution in vitro, it is isotonic. Strength is same to same with plasma, but whenever the solution is injected in the body, glucose is taken up by the cells and it becomes a hypotonic fluid, right? Second and third. So third already we have discussed, 0.9% NaCl is also an isotonic. Ringer's lactate solution or lactated Ringer's solution or Hartmann solution, same name. This is also a isotonic solution. The composition of this Ringer's lactate solution or lactated Ringer's solution or Hartmann solution is exactly same to same with the plasma composition, except it does not contain magnesium. Please remember. So the composition of this Ringer's lactate or Hartmann solution is exactly same to same with plasma, except this solution does not contain magnesium. There is another solution which is known as Ringer's solution. So here the lactate word is not used. It is not lactated Ringer's or Ringer lactate. No, it is only Ringer's solution without lactate. So this Ringer's solution, the composition is same to same with Ringer's lactate, except it does not contain sodium lactate. Means if the sodium lactate is not there, then that is only Ringer's solution, simply Ringer's solution. And if additional sodium lactate is given, then that is Ringer's lactate solution. Ringer's lactate composition is same to same with plasma, except it does not contain magnesium. This is all the isotonic solution which we used clinically in different patients, right? So if you use any solution strength which is lesser than this, like for example, suppose I am using a solution which has a strength of 0.45% NaCl solution, it will be known as hypotonic solution. Very simple. And if I use a solution strength of 3% NaCl, so it is very higher than 0.9% NaCl, so it will be known as a kind of hypertonic solution. So all this kind of solution is also used for clinical purpose only, right? So now we are going to discuss this Darrow-Yannet diagram, that how this Darrow-Yannet diagram will change in different types of fluid gain or fluid loss. So take one example. Suppose first example is gain of isotonic fluid. That means the example we have already given, that suppose you have given 0.9% NaCl solution to a person. You have given 0.9% NaCl solution to a person. What will happen? ECF volume will increase or ICF will increase or both the compartment volume will increase. What will happen to the osmolality of this person? If I ask you this kind of question, then answer will be given by this Darrow-Gyan diagram. Look at. So this is the normal diagram that we have already made. Okay. Normal diagram. So x-axis is the volume, and y-axis is the osmolality, right? So whenever you give any kind of solution, it will first enter in the blood. Blood means that is a part of the ECF. So what will happen? Your ECF volume will increase. Look at this diagram how I am drawing. So in x-axis, this ECF volume is enlarging. ECF volume expansion is going on. So this is the new volume of the ECF. So volume has expanded. Now I am asking myself, what will happen to the osmolality of the ECF now? Will there be any change in osmolality of the ECF? Answer is no. Because what kind of solution you have given? This is isotonic. The osmolality is same to same with the ECF osmolality. So what will happen? The new box will look like this, that without any change in osmolality, only there is expansion of the extracellular fluid volume. But because there is no change in osmolality of the ECF, there will be no change in ICF volume in these cases. Getting my point? I'll show you how the ICF volume can change if you give hypotonic kind of fluid. But for the isotonic kind of fluid therapy, only there will be expansion of the ECF volume. There will be no change in osmolality of the ECF. There will be no change in ICF volume also. Means this compartment the volume will remain constant, no change in volume. That's why it is said that isotonic fluid therapy is very safe kind of fluid. Not much problem in isotonic kind of fluid therapy. Why? Because only the ECF volume will be expanded. What will happen in that? Your blood pressure will rise. Okay, baroreceptor will control that. And your volume will rise. No problem. The kidney is there. Kidney will control that blood volume. But if there is expansion of the ICF, cell is expanded, then there will be more problem. That's why it is said that isotonic fluid therapy is safer kind of fluid because it will only expand the ECF volume, right? So this is gain of isotonic. Now next problem, you take that loss of isotonic fluid from the body. Loss of isotonic fluid from the body. Examples is suppose there is a hemorrhage. So there is loss of plasma from the body, that is isotonic, or suppose there is vomiting going on. Okay, vomiting going on. So these are the examples of loss of isotonic fluid from the body. In these cases, how the dy diagram is going to change. Again, very, very simple. Okay, so this is x-axis, this is y-axis, this is the whole compartment of the body. So what will happen? Because there is loss of isotonic fluid, only there will be decrease in volume of the ECF. Means now this compartment, ECF compartment, will look like this. So there will be only decrease in the volume of the ECF. Osmolality is not going to change. So the new steady state condition will look like this. So this is the new steady state condition with a contracted extracellular fluid volume, but there is no change in ICF volume or there is no change in osmolality. This is loss of isotonic fluid. This is very simple, but the more difficult thing is that whenever there is gain of So now we are discussing gain of hypotonic fluid. Hypotonic fluid. Okay. Gain of hypotonic means if you are giving 0.45% NaCl therapy, solution therapy to a patient, or the clinical example of this condition is SIADH. You must have heard this thing. Syndrome of inappropriate antidiuretic hormone secretion. So whenever your ADH level is very high, it will absorb more and more water from kidney, and excess water will be added to the blood. Excess water will be added to the extracellular fluid volume. That is an example, gain of hypotonic fluid. Or if you drink more and more water, psychogenic polydipsia. So basically any kind of drinking, okay, whether it is mineral water or normal tap water, all of them are hypotonic kind of water only. Okay, even if you use the mineral water also, the mineral content is very lesser than isotonic solution. So psychogenic polydipsia or SIADH, they are the example of gain of hypotonic fluid. In this condition, how the DY diagram is going to change. So x-axis, okay, so this is the box and this is the y-axis, right? So whenever there is gain of any kind of fluid, remember there will be expansion of this ECF volume. So ECF volume is expanded. Now you have to think of osmolality. Okay, now you have to think of osmolality, right? So because the gain is hypotonic of fluid, the total osmolality of the ECF, what will happen? ECF osmolality will fall. Getting my point? So kidney is absorbing more and more water, only water. Solid is not absorbed in presence of ADH. So only water and water is absorbed, and that is added to the plasma. So what will happen to the net osmolality of the plasma? Decreases. So the ECF osmolality will decrease like this. So this is the new point of osmolality and this is the new point of volume. So basically I can understand that this is the new box, okay, where I can understand that the ECF volume is expanded and ECF become hypotonic. ECF tonicity reduces. Now this is not a steady state condition, right? Because if you look at of your left hand side, so this ICF osmolality is higher in comparison to this new condition, right? So this is not a steady state condition. So now I can imagine that cell osmolality is higher and ECF osmolality is lower. Imagine one cell is dipped into an hypotonic solution. Getting my point? So now your ECF solution is behaving like a hypotonic solution in comparison to your ICF. So what will happen? We all know that now there will be osmosis. So there will be osmosis. By the process of osmosis, water will be moving from hypotonic ECF to the ICF. So whenever water is moving from ECF to ICF, what will happen to the ICF volume? So now the ICF volume will expanded because water is entering inside the ICF due to osmosis. So ICF volume is expanded. Now what is entering in the ICF? Only water, only free water, not the solute. So what will happen to the net tonicity of the ICF? Again the net tonicity of the ICF will be decreased. So this will continue until and unless there is an equilibrium condition. Equilibrium condition means whenever the ICF tonicity become equal to the ECF tonicity, this movement of water will stop at that point, and that is the equilibrium condition. So at this equilibrium condition, I can understand the picture is looking like this. This means if you give hypotonic fluid, there will be expansion, there will be increased volume, there will be increased volume of both ICF also and ECF also. Getting my point? And what will happen to the osmolality? There will be decrease in osmolality of both ICF and ECF. Getting my point? So this is the beauty of hypotonic fluid therapy. Okay, ECF volume is also expanded, ICF is also expanded, both the osmolality is decreased to a new steady state level. Okay, so hypotonic fluid therapy is not good. If you give huge amount of hypotonic fluid therapy, what will happen? Your cell volume will be expanded. Cell volume is expanded. What is the meaning of that? Meaning intracellular edema may be created, and that's why we say that hypotonic fluid therapy in excess is not good fluid therapy, because it can lead to cerebral cellular edema of the cerebral cells, right? And that may lead to multiple complications. So hypotonic fluid therapy in excess is not a good one, right? So this is gain of hypotonic. Now if we look at loss of hypotonic, okay? So next is loss of hypotonic fluid, okay? There is loss of hypotonic fluid from the body. What will happen? So the clinical condition is, okay, diabetes insipidus. You know that because the ADH is deficient or ADH is not able to work, what will happen? Excess amount of water is excreted through urine, only water, not the solute. So just imagine a condition where excess amount of free water is excreted from the body. How the DY diagram will change, okay? So this DY diagram can also be given as an image based question, so be careful about that. Try to draw yourself. Very simple. If you understand one, it will be very, very easy. So this is normal diagram, black color. Now loss of hypotonic fluid. So first of all, there will be decrease in this ECF volume. There will be decrease in this ECF volume because loss of fluid from there. But only water is going out, solute is remaining in the ECF. Getting my point? So what will happen to the net tonicity, net osmolality of the ECF now? The osmolality of the ECF will be higher than normal. Okay? So osmolality of the ECF is rising. So this is the new condition. So now I can understand that ECF, although the volume is contracted, but the tonicity of the ECF is more. The tonicity of the ECF is more. This is the new box. Means now your ECF is hypertonic in comparison to ICF. So what will happen to the water movement? Water will move from low solute concentration to high solute concentration. That is the meaning of osmosis. That is the meaning of osmosis, right? So now the water is moving out of the cell and entering in the ECF. So what will happen to the cell volume? The cell volume will start decreasing. Okay. And because only water is going from cell to ECF, the osmolality of the ICF will also start increasing, and this will continue until and unless there is a steady state equilibrium condition. So in this way, I can understand that if a person is losing huge amount of free water, like for example in diabetes insipidus, what will happen to the volume of the ICF and ECF? Both volume will be decreased. So there will be decrease in volume of ICF as well as ECF. Volume will be contracted. And what will be happen to osmolality of ECF and ICF? Both the osmolality of ECF and ICF will be increase. That is the typical scenario of diabetes insipidus. That is the typical scenario of loss of hypotonic fluid. Getting my point? So this is all about loss of hypotonic and gain of hypotonic. Now coming to the hypertonic. So the last one is the gain of hypertonic fluid. Gain of hypertonic fluid. Okay, there are certain conditions, where you have to give infusion of 3% NaCl solution to patient. Okay, 3% NaCl solution to patient. So this is 3% NaCl in hypertonic solution. If you give this kind of hypertonic solution, how this dy diagram is going to change. Okay, so this is the normal diagram in black color. You have given infusion of 3% NaCl, so there will be expansion of the ECF volume first. Not only expansion of ECF volume, there will be increase in ECF tonicity because the solution that you are giving is hypertonic solution. So osmolality of the ECF is also raised and volume is also raised. So this is the new ECF volume and new osmolality of ECF. So now your ECF is hypertonic in comparison to ICF, right? So again the same thing, the water will move out of the cell in this direction. So the ICF volume will be decreasing, okay, and ICF tonicity will increase. This will continue until and unless there is an equilibrium. So in this condition, the ECF volume is increased, okay, but ICF volume is decreased, and osmolality of both ICF and ECF has increased. Getting my point? So every graph is different. We have previously seen this kind of diagram. Where volume of both has increased, volume of both has decreased, but osmolality has increased. But here I can find out that only the ECF volume is increased, but ICF volume is decreased, and osmolality of both the compartment is increased. That is the gain of hypertonic, right? And the last one, okay, loss of hypertonic. Loss of hypertonic fluid from the body. Could you think of any example of loss of hypertonic fluid? Solute is lost in excess of water. The typical example is adrenal insufficiency. Adrenal insufficiency, right? So if the aldosterone hormone is not there, so what will happen? It will not be able to absorb the salt. So along with solute, the water will go out of the body, excreted from the body, and more amount of solute is excreted rather than water. So that is hypertonic loss. So what will happen to the dy diagram in this condition? So this is the normal dy diagram, okay, black color. Now loss of hypertonic fluid. So there will be decrease in volume of the ECF, okay, but because the fluid which is lost from the body is hypertonic loss, so what will happen to net tonicity of the ECF? The net tonicity will be reduced, right? So now the new graph will look like this, okay, new graph is looking like this. ECF volume is contracted, but ECF tonicity is also decreased because more solute has been lost from the body. Now your ECF is hypotonic in comparison to cell volume. So water will shift from ECF to ICF. Although your ECF volume is contracted, but still some water will enter in the cell, and this will rise the cell volume a little, and this will decrease the cell osmolality, and the new steady state condition will look like this. Very peculiar condition, very peculiar condition. So what is happening in this hypertonic loss or adrenal insufficiency, I can understand that there is decrease in ECF volume, there is increase in ICF volume, there is decrease in tonicity of both the compartment, there is decrease in osmolality of both the compartment. So this is all about the shift of body water between different compartment, okay, and the image based question that can also be given. So we have also discussed the DY diagram in different scenario. Now let's do some MCQ. Okay, so first MCQ, the volume of distribution of intravenously administered sucrose in a healthy 70 kg man. Okay, so first catch in this question is sucrose. Sucrose is used for which volume measurement? If you recall, sucrose is used for measurement of the ECF, right? So in this question, they are asking what is the volume of ECF in a person who has a body weight of 70 kg? That is the question. Getting my point? Because you are injecting sucrose. So 70 kg means, I told you already, 70 kg means 42 liter is the total body water. We all know that 1/3 of this is distributed in the ECF and that is 14 liter. So this is the answer of the question. Very simple, okay? Only catch is sucrose. So it is ECF. Now second question, again it is sucrose. So you are measuring, again it is sucrose, you are measuring ECF. Now this question is based on volume of distribution principle. So V is equal to Q minus E upon C. This is the formula I have to apply in this question. If you read the question all, then you will be understanding that this is the formula that you have to use. So how much substances you are injecting here? 100 milligram of substances you have injected. So Q is 100. So Q is 100. Then 5 milligram of substances has been metabolized during this period. So 5 is E. E is equal to 5. So 100 minus 5 upon. What is the final concentration? That is 0.01. So this is 0.01, right? But, okay, so you have to understand here that 100 milligram minus 5 milligram upon 0.01. So this is 95 upon 0.01. That means this is 9500 ml. 9500 ml is equal to 9.5 liter. So this is the answer of the question. I hope you got it. Okay, so this is the second MCQ. Now if you go here, the third and fourth MCQ. The third MCQ is total body water difference between male and female is not seen at the age of. I told you repeatedly. The difference between male and female body water distribution arises for the first time in and around puberty. Means before puberty there is no difference. And after puberty, up to the old age also, there is difference between male and female body water. So I have to search one age group which is near to puberty, and in this question, this 10 to 18 year is the best possible answer. So this is an MCQ of Gymmer. Your answer will be 10 to 18 year. Up to 10 to 18 year, difference between male and female body water distribution is not different. And the last question is, there is loss of 1 liter of water from your body. So water, I told you, free water means hypotonic. Free water means hypotonic. If there is loss of free water, hypotonic water, which volume will be decreased? We have already seen from Darwinian diagram. If I show you the diagram, see, loss of hypotonic. Loss of hypotonic, we have already discussed. Okay. What will happen? There will be reduction in volume of ICF as well as ECF. So please note down that if this question is asking that there is loss of isotonic water, then there will be only decrease in ECF volume. how much decrease? 1 liter ECF volume will be decreased. That is the answer of this question if it is isotonic. But because it is hypotonic, there will be decrease in ECF volume also, there will be decrease in ICF volume also. So 1 liter will be lost from both the compartment, but how much will be lost from which compartment? Answer is, it is according to their original volume, means 2/3 will be lost from this compartment and 1/3 will be lost from ECF compartment, because this is 1/3 and 2/3 is the original distribution of these two compartments. So 1 liter has been lost, 1/3 of 1 liter, that is 333 ml will be lost from ECF, and 667 approximate this amount of water will be lost from ICF if there is loss of 1 liter of total water which is hypotonic. So they are asking how much volume will be lost from ICF. So my answer will be 667 ml, that is B. So this is all about your body water